Okay, so my case is a 55-year-old who's 1 day post-op from a spinal fusion from T10 to L5. The patient has left leg weakness with grossly 3 out of 5 strength due to the spinal cord compression. Right leg is a 5 out of 5 in strength. The patient also has very strong upper extremities. They are on oxygen since they just got out of surgery. The starting position is supine in bed. The doctor's orders are weight bearing as tolerated on bilateral lower extremities, and the task for today is to get the patient out of bed and into a wheelchair, expecting to provide moderate assistance. So, hello, my name is Evan. I'll be your student physical therapist today. Can you confirm your name and date of birth for me? Great. Sydney, how are you feeling today? Okay. All right, so I take it that we just had a spinal fusion, and we want to get you sitting up and get you into a chair before we can get you out of the room. Is that correct?
Yep.
So let me get some gloves on, and then what we're going to do, we're going to roll you onto your side, get you sitting up, and then I'll help you stand up and get to that wheelchair, and then we'll roll you on out, all right? Okay. 1 second. Alright, so need to maintain proper spinal precautions. We don't want to bend, lift, or twist. So if you feel like you ever need to bend, you're going to hinge at those hips. So bend and straight at the hips, keeping the spine flat, okay? So the first thing we're going to do, go ahead and relax this right arm. Go ahead and reach slightly across with the left. Good. And go ahead and bend this left leg for me. A little bit more. Perfect. So what I'm going to do is I'm just going to roll you onto that right side. And then when I get you onto that right side, I'm going to swing your legs off, and you're going to kind of come up onto your elbow, push yourself to your hand just to maintain that spinal angle, and then I'm going to assist the upper trunk into a seated position before we get you in the wheelchair, okay? So we're going to roll on the count of 3. 1, 2, 3. Okay, right there. Alright, so now what we're going to do, oxygen out of the way, I'm going to swing these legs off, and as I do that, kind of push up onto that elbow. Okay, we're going to go real slow. So go ahead and bend this leg for me, put this one on top, and we'll roll these off on 3. 1, 2, 3. Good, onto your elbow, and then just real slow, I'm going to support you on the way up, okay? Good, you okay right there? Alright, I'm going to go ahead and lower you down. Alright, you okay right there?
Yep.
Feel pretty stable? Alright, give me 1 second. I'm going to grab a gait belt. Just for some extra safety, I'm going to put this around you, and we'll get you into the wheelchair, okay? Alright, go lift those arms for me.
I need to get on. That's the one class, the one exam I'm scared for.
Not too tight, are you okay? Still feeling okay?
Yep.
Just gonna slide this wheelchair a little bit closer. Bring it towards us. Make sure those wheels are locked, ready to go. I want to do a stand pivot for you, so I'm gonna assist you while we're blocking that left leg since it's a little bit weaker. I'm gonna assist you up. We're gonna stand straight up, pivot a little bit, and then sit back down. So when I stand you up on the count of 3, I want you to push through the hands, okay? Just help me out a little bit. Get you standing, sit you back down, okay? All right. I'm gonna block that knee coming out. Put my hands on the gait belt, and then you can kind of lean towards me just a little bit at those hips.
Okay.
All right, and then on the count of 3, we'll stand. Go ahead and pivot. Okay, ready? 1, 2, 3. Good. I'll take a few steps. Pivoting. Good. We'll sit straight back. You can reach back to the armrests. Perfect. You okay right there?
Yep.
All right. All right, so we're back with the same patient 2 weeks later, 55-year-old, 2 weeks post-op from their spinal fusion. The patient presents to an outpatient clinic ready to progress their gait. Their starting position seated in a chair. The right extremity is still very strong. The left lower extremity is still moderately weak, but a little bit better. Upper extremities are still very strong, and they are no longer on oxygen. The orders are still weight bearing as tolerated, and the task is to initiate gait training and teach the patient how to ascend and descend a 4-inch curb. So Sydney, how are we feeling today?
Good.
All right. So today we're just gonna fit you for an assistive device, teach you how to use it, teach you how to walk with it, and teach you how to get up and down curbs with it, okay?
Okay.
So the first thing I'm gonna do is put this gait belt around you for some extra safety. Put the arms up for me. Got you tight, are you okay? Next thing I'm gonna do, if it's okay, I'm just gonna palpate your greater trochanter. You can kick up this leg onto mine. I'll go ahead and do some windshield wipers with your foot. Perfect. I'm just gonna fit you for this assistive device before we get it ready for you. All right, relax that leg. Perfect. Time. Alright, so the first thing we're going to do for you, I'm just going to demonstrate the gait that I want you to practice with this walker. We'll get you up, get you trying it, and we'll go from there, okay? So what we're going to do for you, is since we are weight bearing is tolerated with both extremities, we're going to do a modified 3-point gait. Okay, since that left one's weaker, that's going to be the one we lead with, okay? So we're going to roll the walker. We don't want to lift this one up since there's wheels. So roll it forward, kind of lean on it with the upper extremities, step with the left, bring the right towards, okay? Roll, go weak to strong, okay? Same thing, and then we'll come over here to the curb, and to get up, we're gonna push this as far as we can, step all the way in it, then we're gonna lift it up and onto, and then we're gonna lead with the strong. So the right's gonna go up first, left's gonna follow, okay? And then to get down, same thing, we're gonna go all the way as far as we can, come down with the walker, lead with the weak this time on the way down, and bring that strong, okay? We're also gonna teach you a sit to stand, so we can do this by ourselves when we're feeling up to it. So you can go ahead and put one hand on the bottom of the chair for me, one hand on the top of the walker. I'm gonna help you up, and I'm gonna block that weak knee a little bit with my left hand, and on the count of 3 we'll stand. Okay, you ready? 1, 2, 3. Awesome. Alright, so now we're gonna head over to that curb, practicing that gait that we just had. So go ahead and release the walker, awesome. Left foot, and then bring that right. Perfect. Left foot, right. Perfect. And one more step. Awesome. So now bring that walker up, all the way on. And we'll lead with that strong, so lead with the right. Good. Now we're going to come over to the other side of this curb. We're just going to kind of stand on the side a little bit in front of you. So take one more half step for me. Perfect. And then bring that walker down. Good. Now we're going to step with the strong, so that right will come down first. And bring the left. Good. Okay. All right.